is a very important topic in anatomy and also an important question. Inguinal canal is an oblique intermuscular passage which is about 4 cm long and it is present above the medial half of inguinal ligament. Extent of inguinal canal. It extends from deep inguinal ring to the superficial inguinal ring. The deep inguinal ring is an oval opening in the fascia transversalis, which is 1.25 centimeters above the mid-inguinal point. In superficial inguinal ring is a triangular opening in external oblique aponeurosis, and it is present just above the pubic tubercle. Deep inguinal ring is an opening in the fascia transversalis, and superficial inguinal ring is a triangular opening in the external oblique aponeurosis. The direction of inguinal canal. It runs downwards, forwards and medially. This is a diagrammatic representation of inguinal canal. Deep inguinal ring, which is oval, superficial inguinal ring, which is triangular, and this is the inguinal canal. Anterior superior iliac spine, pubic crest and pubic tubercle. This is the inguinal ligament. The deep inguinal ring is 1.25 centimeters above the mid-inguinal point. This is a diagrammatic representation of inguinal canal. Let's now see the boundaries of inguinal canal and also the coverings of the spermatic cord. First, boundaries. Let's take a coronal section. This is how it looks like. The anterior wall is formed by skin, superficial fascia, external oblique aponeurosis. This is external oblique muscle which continues as external oblique aponeurosis, green color line, and internal oblique muscle fibers in its lateral 1/3. So these form the anterior wall. And now the posterior wall. This is formed from deep to superficial by fascia transversalis. The blue line is the fascia transversalis. Next, conjoint tendon in medial 2/3 and external oblique aponeurosis. Its reflected part in the medial most. So these form the posterior wall of inguinal canal. Next, let's see the coverings of spermatic cord. It's made up of 3 layers: external spermatic fascia, cremasteric fascia and internal spermatic fascia. The external spermatic fascia is the continuation of external oblique aponeurosis. Cremasteric fascia is a continuation of muscles of internal oblique, and the internal spermatic fascia is the continuation of fascia transversalis. These are the 3 layers of spermatic cord. The outermost is skin, and next is dartos muscle, which is present in the superficial fascia. The sagittal section. There is the sagittal section of inguinal canal, in which we will see the roof and the floor. The roof is formed by arching fibers of internal oblique muscle, and the floor is formed by the inguinal ligament predominantly. So roof, floor, anterior and posterior boundaries. These are the boundaries of inguinal canal.
Me and the boys are on a level to flying field.
Start your day off right with a healthy dose of news. Just like breakfast fuels your body, keeping up with current events fuels your mind. Make news reading a part of your daily ritual, and stay informed and engaged in the world around you. Download InShorts, India's #1 English news app, serving you daily news summaries in just 60 words.
These are the boundaries of inguinal canal. The contents of inguinal canal. In male, the contents are spermatic cord and ilioinguinal nerve. In females, round ligament of uterus is present in place of spermatic cord and the same ilioinguinal nerve. Important point to note is the ilioinguinal nerve is only a partial content of the inguinal canal. This is because it enters the canal from the side through a slit between the external oblique and internal oblique muscles. So it does not enter through the deep inguinal ring. That is why this is referred to as partial content, and this lies in front of spermatic cord in males or round ligament of uterus in females, and it passes out through superficial inguinal ring. And the ilioinguinal nerve supplies the inguinal region. These are the contents of inguinal canal. The mechanisms to maintain the integrity of inguinal canal. This is a very important question. The inguinal canal is a site of potential weakness in the lower part of the anterior abdominal wall. So it may provide herniation of the abdominal viscera. So it is required to maintain integrity of the inguinal canal. The main mechanisms include flap valve mechanism. The inguinal canal is situated obliquely. The superficial and deep inguinal rings are not opposite to each other. They are situated in an oblique way. So, when the intra-abdominal pressure increases, the anterior and posterior walls are approximated like a flap. That is why this mechanism is called flap valve mechanism. Second is guarding of the inguinal rings. The deep inguinal ring is guarded anteriorly and the superficial inguinal ring is guarded posteriorly. This is deep inguinal ring guarded anteriorly by the internal oblique muscle, and the superficial inguinal ring guarded posteriorly by the conjoint tendon and reflected part of the inguinal ligament. These are the guardings of the inguinal rings. The third is shutter mechanism. The internal oblique muscle surrounds the inguinal canal in the front, forming a part of its anterior wall, above forming its roof, and behind forming a part of its posterior wall. So therefore it forms an arch over the inguinal canal. So when the internal oblique muscle contracts, the roof is pulled down and is approximated on the floor like a shutter. So this mechanism is called shutter mechanism. The fourth is slit valve mechanism. Here, when there is contraction of external oblique muscle, it approximates the two crura, medial and lateral, of the superficial inguinal ring like a slit valve. So when there is contraction of external oblique muscle, it approximates the medial and lateral crura of the superficial inguinal ring like a slit valve. So this mechanism is called slit valve mechanism. The fifth and the last mechanism is ball valve mechanism. When there is contraction of the cremaster muscle, it pulls the testis upwards, which plugs the superficial inguinal ring by the spermatic cord. So when the cremaster muscle contracts, the testis is pulled up, so there is plugging of superficial inguinal ring by the spermatic cord itself. These are the 5 mechanisms to maintain the integrity of the inguinal canal. Note, the interfoveolar ligament also helps to maintain the integrity of the inguinal canal. It strengthens the fascia transversalis laterally. So thereby it also helps to maintain the integrity of the inguinal canal. Next, let's see about inguinal triangle, also called as Hasselbalch's triangle. This is situated deep to the posterior wall of the inguinal canal. So therefore it is seen on the inner aspect of the lower part of anterior abdominal wall. The Hasselbalch's triangle is situated deep to the posterior wall of inguinal canal and seen on the inner aspect of the lower part of anterior abdominal wall.
చాలా ఫాస్ట్గా నడుస్తున్నావు అక్క. ఇంతకు ముందు నా వెనకాలో నడిచేవారు.
అరే నా స్పీడ్ మారలేదు, నువ్వు ఈ మధ్యలో అలసిపోతున్నావు. అంతా కులాసేనా?
కాస్త ఎముకలు నొప్పిగా ఉంటాయి.
షీలా, నీ వయస్సు పైపడుతుంది, ఎముకలు కంప్లైంట్ చేస్తున్నాయి, నువ్వేమో పట్టించుకోవటం లేదు. 40 దాటిన తర్వాత రోజు షెల్కాల్ 500 తప్పనిసరి. షెల్కాల్ 500 దీని కాల్షియం ఎముకలను దృఢంగా ఉంచి అలసిపోనివ్వదు.
The boundaries of the inguinal triangle, also called as Hasselbalch's triangle. The medial wall is formed by lateral border of rectus abdominis. This is the rectus abdominis muscle and the lateral wall. Lateral boundary is formed by the inferior epigastric artery, which is a branch of external iliac artery. And the base is formed by medial half of the inguinal ligament. As it is a triangle, it has 3 boundaries: medial, lateral and inferior. Medial by the lateral border of rectus abdominis, lateral boundary by the inferior epigastric artery, and the inferior boundary by the medial half of inguinal ligament. Next, let's see about inguinal hernias. We'll see the basics here, but the main part of inguinal hernias will be covered in surgery. Inguinal hernias are protrusion of abdominal viscera into the inguinal canal. It is marked clinically as pear-shaped swelling above and medial to the pubic tubercle and above the inguinal ligament. So there is pear-shaped swelling above and medial to the pubic tubercle and above the inguinal ligament. There are 2 types of inguinal hernias: direct and indirect hernia. The indirect inguinal hernia is the most common type and more often it occurs in males. Let's see the basic differences between indirect inguinal hernia and direct inguinal hernia. The site of protrusion of hernial sac is deep inguinal ring in case of indirect inguinal hernia and posterior wall of the inguinal canal, that is through the Hasselbalch's triangle, in direct inguinal hernia. The shape in indirect is pear shaped, whereas the shape in direct inguinal hernia is globular. Extent: generally scrotal in indirect hernia, and in direct it is rarely scrotal. Direction of hernia: it is oblique in indirect inguinal hernia, that is, it runs downwards, forwards and medially, whereas it is straight in direct inguinal hernia, that is, it is directed forwards. The neck of hernial sac is narrow and lies lateral to the inferior epigastric vessels in indirect inguinal hernia, and the neck of hernial sac is wide and lies medial to inferior epigastric vessels in direct inguinal hernia. So here it is lateral and in direct it is medial to the inferior epigastric vessels. The reducibility in indirect inguinal hernia, sometimes it can be irreducible, whereas the direct inguinal hernia is generally always reducible. Indirect inguinal hernia occurs in young age and direct occurs most commonly in middle and old age. Next is internal ring occlusion test. This is important to differentiate between indirect and direct inguinal hernias. The internal ring occlusion test is positive in indirect inguinal hernia, but it is negative in direct inguinal hernia. What is internal ring occlusion test. After the hernia is reduced, pressure is applied to the deep inguinal ring and the patient is asked to cough. So after reducing the hernia, pressure is applied over the deep inguinal ring and the patient is asked to cough. If there is no hernia, it means it is indirect hernia because the hernia occurs through the deep inguinal ring. As we have blocked it now, it cannot occur. If the hernia reappears on coughing, then it is direct hernia. This is because it occurs through the Hasselbalch's triangle. So internal ring occlusion test is very important to differentiate indirect from direct inguinal hernias. This is the gist of indirect and direct inguinal